First thing I'm going to do is take your picture. Why am I taking your picture? No, I don't take Facebook. On my blogs. Any of you follow any of my blogs? Raise your hand. Brad, you're my hero. So I got your picture. You know, I was noticing something interesting. I'm a blogger, and a marketer. I was noticing something interesting about this room. Have any of you noticed anything interesting about this room? The big-ass fans. Have you already talked about it today? I was sitting over there totally distracted while Jamie was doing her introductions because I'm thinking, big-ass fans. That's making a statement. You know, I wonder if some clients can buy those things and have that covered up if you don't want big-ass fans in the middle of your room, or at least the language. It's interesting. Well, you know, you guys are an intimidating group to present to. I can tell. Do you know why you would be intimidating to a panel talking about social media? You're so damn young. How many of you are under the age of 30? Raise your hand. I don't care if you're on Facebook. You and me both. Right here, brother. Right-handed fellowship. Yeah. You're a scary group. You know, you were born with this stuff. I wasn't. Do you know when I was working on my master's thesis, people didn't even have PCs. I had to go to a computer lab at Appalachian State University, and they had a lab with all Apple computers. Yeah, I see nodding out there. And learn how to do it that way. I mean, it was amazing, and it was foreign to me. I had these floppy disks. The world has changed. But I'll tell you quickly, about 4 years ago, I was sitting in my office. I run a marketing firm in Chapel Hill, North Carolina, and I was thinking about the web and social media and all the things going on, and I said, you know, I was probably, I'm 49 right now, so I was 46, 45 years old. And I said, Dan, if you don't catch on to this stuff and embrace it, you're just going to be left behind as a marketer. And it's true. You know, you become irrelevant so quickly as a marketer if you don't evolve. And the same applies to your marketing within hospitals. Because whether you evolve or not, what's happening? The world is changing and your patients are changing. So, you know, I started a discussion on LinkedIn. Do any of you use LinkedIn groups? I started a discussion on like 10 different LinkedIn groups for healthcare marketers yesterday about physicians not being quick to embrace social media. And man, it got some people really agitated, and they're firing these negative comments back at me. But my point wasn't that physicians have to start blogging right and left. My point was they have to understand this world because that's where their patients are. And that's how their patients are gathering information and sharing information with each other. So you don't have to become a blogger or a social media guru, but you do have to understand where your patients are going because, I mean, they're going to share that info with you. So quickly, I'm going to share with you what some of these folks are doing in the way of social media, and then we can just go through the panel. And I just put this together very quickly. A quick introduction to my theory about social media, why it should matter to all of you. It's not about piling up fans, okay? That is a means to an end. The reason to do social media is to impact your business objectives as a hospital. That's the reason to embrace it. Janie mentioned right off the bat, this should be part of your strategy. So whatever you do in social media should be supporting objectives. If you're building a Facebook site, you know, and trying to build followers, you need to be able to answer the question, why are we doing this? What strategic goals and objectives is this going to reinforce for our institution? And there are many, but that's the way to approach it. I look at it as hive marketing. If you think of a beehive, right, with all the bees buzzing around, what we're doing with social marketing is bringing people into a community. People of a shared interest. People asked me, I was speaking at a healthcare conference in Chicago last week, and some lady in the audience said, why would someone join a hospital Facebook community? And I said, because maybe they're a grateful patient and they love the hospital. We have people who leave our institutions every day who feel like they owe us their lives. Their families are grateful, the patients are grateful. Plus, you have employees, right? A natural constituency that wants to know more about what's going on. So there are all kinds of reasons people would want to come to one of your communities. So they come to this community like a beehive. You bring them in, you are piling up membership and followers. But the reason you're doing that is not just to be able to say, oh, we've got 1,800 followers on Facebook, or I've got this many people following our Twitter feed. The reason to do it is to be able to put those people to work as advocates for your organization in times when you need them. And I will tell you, with my clients, we've used those groups and used those brand advocates within the group for when we're in managed care negotiation. Blue Cross Blue Shield hates me. I will tell you, I am their worst enemy because I use social media against them. And I just single them out because they're the evil empire. But they absolutely hate me. I'm on there. You go in there, like the FBI used to have most wanted. I'm on the top of Blue Cross's most wanted list. And I'm proud of that. But we've used it for managed care negotiation. We've used it for, South Carolina is a CON state. We've used it to help in CON processes. All kinds of business objectives. So it's not just about social media. You know, social media has such a bad rap, especially when you're talking to people in the C-suite. That's not what this is about. This is about creating the community and sending these people out.